Welcome to Smart Brown Voices, your weekly podcast featuring diverse voices from around the world, giving you insights on how others made it big in their respective fields. Now sit back, grab a notebook, and get ready to be inspired. And don't forget to use hashtag #SmartBrownVoices to share insights, moments of wisdom, and things from the show that inspire you. And now, here's your host, social media nerd and technology activist, Mr. Mike Street.
Hey, what's up, everybody? It's your host, Mr. Mike Street, and you're listening to Smart Brown Voices. This is episode 67. We are powering our way on the road to episode 100, which is one of my goals that I want to accomplish before the end of 2017 is to have had 100 episodes. So thanks everyone so much for all of your support to the show. Thanks you for everyone who's been meeting me in the community at different events and coming up to me, telling me you've listened to the show, that you support the show. I'm really honored and really appreciate all of your support. So like I said in the previous episodes, our goal and mission is to get Serena Williams on episode 100. So if anyone out there is listening, has any connections to Serena Williams, please send me an email. We want to have her on the show because she's one of our inspirations for everything that she's done. So today, we're going to be talking to a really smart guy who's doing some amazing things. So Junior, introduce yourself to the Smart Brown Voices community.
Great. My name is Dr. Junior Max Destine, and I'm very glad to be. I'm very happy to be participating in your show today.
So, Junior, I mean, your bio is really impressive, and you know you're just like super smart. Probably one of the smartest people we've had on Smart Brown Voices. So, talk to us and tell everyone what you have been working on over the past couple of years, because it's pretty outstanding. What you're doing.
Yes, over the past couple of years, I've been working on basically trying to be board certified here in the United States. But other things other than that, I went to Washington Adventist University, which was then Columbia Union College, and Tacoma Park, Maryland. And after that, I had an interest in medicine. I've always had an interest in medicine. And I had a friend of mine would happen to hear about studying medicine in Cuba. So she introduced me to someone who was a doctor from Nigeria. And from there, it was all done. Pretty much I had applied to the medical school in Havana, Cuba, and got in and was very happy about that. This is where everything pretty much started. This is where I'd learned many things in life, very challenging. But what it does, it taught me the concept of being like a community doctor, which is not something pretty much in the United States doctors are leaning towards to. But it's something that I'm really into because by knowing the community as a doctor, participating in health fairs and such things, and it actually you can relate to patients more, and they can come and see you more, and you can do a lot of good and prevention and things like that.
So why do you think this whole notion of being a community doctor is frowned upon in the United States, but it kind of thrives in other nations?
First of all, it all come down to where I was educated. For example, that's what my concept was. That's where we were trained as that. In the United States, you have a lot of communities that needs doctors to be more involved in them. I would like to be an advocate for that when I am actually practicing medicine. And I think that it's very important because we have such a problem where certain people in our communities are afraid to go see a doctor.
Mm-hmm.
And the time that when they go see the doctor, it's probably the time where it's too late.
Mm-hmm.
And I think that we have to do better than that. I think we can do better than that. And the way in which we do that is to actually make them feel more comfortable with us. I think that people, if they can relate to you, they can see you, they can hear you. You're not playing this type of game where you someone they looked up on, so they kind of like afraid to tell you the truth and how they really feel. So it makes it a little bit more difficult to take care of the issues because as a doctor, I learned that it's not only the someone come and see you and you diagnose and you prescribe. No, it's deeper than that. It's actually where you can relate to the person and in an emotional way, because some people actually that come and see you, they probably have they probably been depressed for a bit, and it's not only the first thing is not to prescribe them. The first thing is basically is to have the talk, and with a small talk you can do a lot of good. You'll be amazed to see what you can do.
I think you bring up a really excellent point, is that, a lot of us are very fearful of going to the doctor because you just don't know, what's going to what they're going to say, or, is the news going to just affect your mood or who you are or anything else, like really, in a more worse way. It's a lot of it is fear. And I think what you're doing now is trying to, dispel that fear and really make the doctor more like, I guess, it's kind of like going back to the olden days, around, I guess it was the 1930s and 40s where, the doctors paid home visits. The doctor was someone that, you would have over for a dinner party because he was kind of like a person that was a member of your family. It's not that way anymore. It's very, corporatized and very, like you only see the doctor every 6 months, and so it is a very different landscape. So how are you trying to bring some of that practice to the United States, but then also what you're doing over in Mexico?
Yes, great. What I'm doing over in Mexico, it's we have a small clinic there, and also at a pharmacy. It's actually called the Good Samaritan Pharmacy. It's a small clinic and small pharmacy, and what we do is that we see patients that are actually in underserved communities, and we actually charge them at a very lower rates than what most Mexican doctor will actually charge them. So I have a cousin of mine who's a medical doctor. He's licensed in Mexico, so he's actually in the clinic right now as I'm speaking with you, taking care of patients. And what we do is we do more of a preventive kind of medicine, because we find out that there are many corporations, of course, Coca-Cola and other things like that in Mexico, and so we try to educate patients and how to better take care of themselves. We are more leaning towards that goal because patient with diabetes, hypertension, and other such and other disease, we try to make them understand, educate them. Education on your pathology and your disease, it's actually very good, because if you understand the complications that will come in the future if you don't do certain things, and so that will help you prevent many damage that can be done further. So that's what we are more focusing on right now. But we do prescribe them if we find that we have to prescribe them medicine. We do prescribe them, and we do not charge them for the medicine. So we what we do is we charge them a small fee just seeing them, but we do not charge them for the medicine.
So does Mexico have like a universal healthcare system, or is it more corporatized?
No, they don't actually have a universal healthcare system. They do have the healthcare system that they have. It's a little bit looks more like ours.
Mm-hmm.
So they do not have a universal healthcare system. But I was able to do that because it's a on private kind of clinics, so and pharmacy. So it's I can do that. I can actually see patients and the way in which I would like to see them. So I'm happy to have that freedom and be able to contribute to this community because they really need it. They really need it.
So
They need for it.
So what's
Yes.
been the response over in Mexico to your practice?
The response is that when I first got there, not too many, doctors will, pretty much do the things that we do over there. But it has not been bad. It's actually people actually like that idea. They welcome us and they very receptive. They appreciate very much what we're doing for them because they know that we are in their interests. We do not look only for the money. We tend to care more about them rather than look for the money, trying to get rich off of them.
So how do you think you'll be able to translate the model that you've built in Mexico over here in the United States?
I think it can be easily translated. I think it can be, easily. I can bring it easily, but I would need like a lot of help. I said from doctors like me who are willing to do things like that. So it's more of on the side of the doctors who are willing to do that, to cooperate with me on that and bring that model that we have. And it's a simple model. It's just that we tend to focus more on prevention. And here, I think in the next years to come, based on what Obamacare has been doing, I think that we're going to be very big in prevention. So I'm looking forward to help more in the communities where I'm most needed. Because when I graduated from Latin American School of Medicine in Cuba, Havana, it was more that the commitment we had was to go on underserved communities and help out and actually and help them, people who are mostly in needed. So I'm very happy, and I'm very happy with what I'm doing now, and I'm very happy that that I would like one day to bring that model here, which has always been my goal.
Cuba is very, there's been a lot of praise given to the practice of medicine in Cuba. Why do you feel that, that area has excelled and is looked at as a model to kind of replicate in other countries?
Yes, they have, because of what they've been willing to do. They've been willing to share the little bit of with what they have with the world. And Cuba and Latin American School of Medicine, if you don't know, it was first conceived reportedly from an idea of the president, which they had that time was President Fidel Castro himself, as a part of Cuba's humanitarian and development aid response to the devastation earthquake that had happened. So that is why the school that I went to was created in 1998. I don't know if you remember the Hurricane George and Mitch that occurred, and which affected several countries, like, for example, in Central America and the Caribbean, even including Cuba. So a lot of people died that time as a result of that. And so the president there decided that he would open up the school, Latin American School of Medicine, and give it 500 full scholarships to students from every part of Latin America, Central America, South America. So all these students will go there. There will be about 500 from each countries, and they will receive a full tuition. And now you're going to ask me, how was the United States related to that? We never had any hurricane here. Well, we did not have any hurricane, but in June 2000, a U.S. Congressional Black Caucus delegation visited Cuba to meet with the president, and the representative Bernice Thompson from Mississippi mentioned to the president of Cuba that his district had a shortage of doctors, and he responded quickly by offering a scholarship for U.S. nationals to study at Elam, and that was how everything started. That's how everything started in 2001. Elam had the first student going there to study medicine, and from now on, and it's been every year that students from here go to Cuba and study medicine for free, and that model of prevention, which what you study there is basically you learn very much about preventative medicine, and to become that community doctors that you not only in the clinic, but you go out there to the field and knock out on people's door and find out, for example, we had an episode of dengue fever in Cuba where we're doing that moment. We'll go to doors and find out the symptoms and know whoever has that kind of symptoms have to be reported to the hospital. So by doing that, you save so many lives. So we were that kind of doctors that would go to the community. We were not strangers to the people. So it was an amazing ride, and I think that we ought to bring something like that. Not exactly, but we ought to bring something like that where we can actually relate to the community, and they will feel more safer with us. And it's been proven, and I've done it, and I've seen it done. So it's not impossible.
Awesome. That really sounds amazing. I mean, it really sounds amazing, but it actually sounds, like common sense as well, because I feel like if we have, doctors that are in and of the community, and I think this is also something for the, the police departments of America to start to look at as well. But if you have doctors who are of the community, police who are of the community, you can have, you should be able to have a better sense and a better pulse on what is affecting this community, because your health is very much related to, your environmental situation, so you guys going out door to door and talking to people, but also, looking at what is happening around. This makes sense, and it gives a much better treatment that you can do for your community. So I think that's amazing.
Yes, and I think that model. I would hope that one day that we have something like that where doctors are not strangers to patients. It's not someone that you've seen for you just treat and you send home. It's someone where you kind of like create I would say like a total relationship, but it's someone that you have their real needs, their psychological components, everything pretty much about that person. It's not only about the disease, but how they doing, how their son's doing, are they going to school, what are they doing, are they playing basketball, are they playing soccer? It's most likely like to develop a kind of like, doctor-patient relations. And that's all it's about. To have better care, you have to have that. And I wouldn't call it full care. It's basically, it will be more likely. Anything less than that will be, a customer-client kind of, relationship, I'll call it.
Well, Junior, we have a segment on our show called the Smart Six. And so I'm going to ask you 6 questions, and you're going to give me the first answer that pops into your head. So are you ready?
Sure. Let's see.
All right. Question number 1. What book changed your life?
As a Man Thinketh.
Say that, repeat it.
As a Man Thinketh by James Allen.
Gotcha. All right. Number 2. What's your favorite song that you're jamming to right now?
Wow. My favorite song that I'm jamming to right now.
Yep.
Wow. I don't have a special one, but Wow, that's a hard one.
It's all good. All right, so number 3, what's the one thing that you
Let's
do
go to
to
number
relax?
3, then I'll come back.
Okay, what's the one thing that you like to do to relax?
I like to play guitar to
Okay,
relax.
nice.
Yes.
All right, so what's the one movie that you've seen probably like 100 times?
Wow. Gladiator.
Okay, nice. Number 4, who's another smart brown voice that you look up to and respect?
Another smart brown voice. Person or?
Yeah, person.
Well, I'll tell you who it is. I'll be looking forward to meet Richard Pelzer.
Okay, nice.
Yeah.
Cool. And for you guys who don't know who Richard is an amazing person, a member of the Harlem community, does a lot for a lot of people. So a lot of the guests that you've actually heard from on Smart Brown Voices for the past couple of months have been through Richard. So big shout out to Richard, and we're going to have him on a show in the next couple of weeks.
Great.
And our final question is, what can our listeners do to help support you?
Great. It's easily to support me. The best way is you can get in contact with me, or what we do is we sometimes send medication sometimes to Mexico. If you know a way in which you can get medications, or if you can support us financially too, that will be very helpful. And you can give them my connections on my email and such, and they can get to me in that way. And I'm looking forward to be board certified here, and I would like also to help out the best that I can in the community, and where it's most needed. So it's all will be everything that is done is something that is going in circle. So I look forward for your help.
Awesome. Well, Junior, thank you so much for being a guest today on Smart Brown Voices.
Great. I thank you for having me participate in your show. Thank you.
All right, guys, that's it for episode. Feel free to email me at shootfirst1@gmail.com if you would like to be a guest on this show, because I want to get all of our stories out there and really change the narrative around who people of color are in this country. Because with everything that's going on, from Alton to Philandra, Castile, and just everyone in between, we have to really support everyone in our community. And that's why this show exists, is to be a resource for you and to really kind of connect with other business leaders, people like Junior who are doing amazing things in America, but also in other countries as well. So we have to be kind of a connective tissue with each other and support everything that everyone else is doing. So everyone, thank you for your support of Smart Brown Voices, and we'll see you again on the next episode. Peace out.
Thanks for listening to Smart Brown Voices with your host, Mr. Mike Street. If you like what you just heard, we hope you'll leave a review on iTunes and tell your friends and colleagues. Be sure to check out our archive section on our website for previous podcasts, and make sure to follow us on social media. This has been a Mr. Mike Street production. Join us next time for another edition of Smart Brown Voices, and be inspired.